Good evening. I'm Angela. Thank you for joining us tonight. Thank you for catching the replay. If you're catching the replay, if you have any questions, on this screen is my contact information. You can reach out to me here via email, text message, or you're also welcome to comment and we will see that and get back to you. So we're going to jump right in. I like to keep this to 30 minutes or less. And we'll be jumping through all of the details of what Young Living and Clearwater's partnership is with our health share program. This is an alternative to traditional health insurance. And I'm going to kind of be explaining what are the differences. So let's start with that. A health share is, or with Young Living and Clearwater and our relationship, the health share is a nonprofit. So that's one of the biggest differences between this and traditional insurance. Traditional insurance is a for-profit business. The first thing talking about here is that a health share is a nonprofit business. Health insurance, traditional health insurance, is a for-profit business. So one of the things when we start talking about prices later, you're going to see is that this is way less than traditional health insurance on the costs. So first thing here, what is a health share? A health share is a community of individuals covering healthcare expenses. So our monthly premiums that we are paying into the organization help cover medical costs. And as I mentioned, it's a nonprofit. So if you're familiar with nonprofits, there are limitations to the amount of profit that a business or a company can have and still be classified as a nonprofit. So that is a really big deal because it's about the people and putting money back towards our expenses. I'm a client as well. This is what my family has. I'll share that in a few minutes as well. But it makes a big difference on the costs and the expenses. With the health share, there's an annual max. With traditional health insurance, you're probably used to the a deposit, or not a deposit, a copay, not a copay. Gosh, I can't even think of my words now. Forgive me. Um, you probably have a deductible. That's the word I'm looking for. So you probably have a deductible. When you have a deductible, you're responsible for 100% of your costs of that. And then after that, you probably have a max out of pocket. So then that's when you share expenses with your health insurance. So maybe they pay 80% and you pay 20%. With the annual max, you only have one amount that you are responsible for. So it's the first 1,000, 2,500, or 5,000, and then expenses are shareable. After that, pretty much 1,000 or 100% of your expenses are shared within any medical situation that you might have. Clearwater is the specific healthcare provider that created this relationship with my company, Young Living, and they were established in 2018. And really, the goal is to put decisions back into our hands and really change or disrupt the healthcare industry. So that's the goal that we have. This talks about some of the comparisons, a little bit of what I already talked about. A big thing with the health share is that, as I mentioned, decisions are put in our own hands. There is not a list of providers. So you can go to any provider that you want to. You don't have to see who's pre-approved or how much is going to be covered for this doctor. Are they in network or out of network? Coverage and expenses are paid the same for any kind of provider. So let's say you're going to your primary care physician. Um, Anybody is covered the same as long as they're a licensed physician or provider for the service that you're receiving. That's the only thing that is needed. So on the documentation or the paperwork you get, you just make sure that it has like letterhead or their provider information so that that can be verified. In traditional health insurance, there are people or staff members that are reviewing records and paperwork to find reasons or ways to deny. And a big thing with the health share is claims are rarely denied. The goal is to keep us happy so that we're paying premiums and helping keep everybody's costs low within that. So that's one of the things that, again, another really nice thing that I really like about it. This is my family's example. So we're a family of four. We're in our 40s, and we went from regions when we had traditional health insurance last year to we have the ClearShare and the holistic plan. I'll cover those in just a couple of minutes, but ClearShare is major medical coverage. So for things like emergency room visits, hospital stays, and surgeries, the holistic plan is more of your everyday, day-to-day stuff. And again, I'll outline all those details. But when we were with Regents, we were paying over $1,500 a month. And now with the health share, where we've improved our coverage and our services, it's only $955. So we're saving a little over $600 a month. One of the big things for us is that we go to the chiropractor. And previously, we would max out at 12 visits a year. Now we've doubled that. It's 24 visits a year. And we can actually choose for those 24 visits to go to chiropractor or acupuncturist. Previously, we didn't have any acupuncture coverage. We've reduced our out of pocket expenses overall as well. And we have other services that are available to us. We can do IV drips. Honestly, I haven't taken advantage of that. I need to. There's only like four places, I think, in my area to go to. So it's on my list. I just haven't made it a priority. Telemedicine. This is something that's pretty common with insurance, where you have like at least a nurse hotline. With this, what I like about it is there's actual doctors and you get follow-up call if there is a follow-up needed with the same provider. So you don't have to re-explain things to the person that you're talking to for your follow-up. The mental health coverage is also free and it's included in our monthly premiums with this. I have a friend that had a sister pass away and she used these services and she said it's really easy to schedule, easy to do her follow-ups and get connected to them. And she really liked it and is grateful that she had the service. Another really nice thing that I love is that there's supplements covered. So the supplements are covered through Young Living. So any Young Living essential oils or supplements. So I've been with Young Living for 10 years. I had my 10-year anniversary just 2 weeks ago. And I've been buying oils every month for 10 years, but always paid for them out of pocket, right? Because traditional insurance doesn't pay for that type of stuff that's proactive about our health. So that is covered under the holistic side where my family gets reimbursed $75 a month for whatever we choose to buy oil and supplement wise from Young Living. So, talking about the chiropractor and acupuncture, I talked about it a little bit, but this is a really, really nice feature that I like a lot because each visit is covered up to $175. Typically, if you're not getting x-rays or anything like that, it's only going to be somewhere around $40 to $60, and we're responsible for the first 35. So, to take advantage of that full amount, you get add-on services included. So this might look like massage. It might look like light therapy treatments, whatever the treatments are that you get at that visit, and they're on the same receipt. So you pay for it. And then you submit the receipt and you get reimbursement. So let's say it's $175 exactly, you pay for it. When you submit that, they deduct the $35 and you would get $140 reimbursement. I get mine directly in my checking account. And it typically they say is 30 to 45 days for those. I got one earlier this month in 2 days. Went to the doctor on a Tuesday, submitted the receipt Tuesday afternoon. Wednesday morning, I got the confirmation, and Thursday I was in my checking account. That's faster than normal. They don't have a backlog right now. At the end of the year last year, people were taking advantage of making sure they used all their services and got their benefits. So it was taking about 7 weeks, longer than normal. So 30 to 45 days being the average and the norm. I like to share that, but it can be sooner. It can be, faster. It can take a little longer as well. So any questions about anything so far? You guys are easy. Cool. Okay, so this is kind of explaining the three options that there are, and these are kind of the basics. There are more details within each, but ClearShare, that's the medical coverage. So this is your major medical expenses. Again, emergency care, so ER visits, um, uh, surgeries, that type of thing. So something that is kind of a major thing. Holistic, these are your basics, and it's going to be, again, your chiropractic, your normal doctor visits. This is prescription coverage is covered under this, annual mammograms, all those types of things. So you can get those individually, or you can combine them. You can get the medical and the holistic coverage. If you have a pre-existing condition, as a nonprofit, there can be limits around that pre-existing condition. So it wouldn't necessarily be covered. So we want to talk about that. If you have some, you're welcome to type them in the chat, or when I open it up to questions, you can let me know if you have questions about a specific situation, so we can discuss them. But holistic is available to everybody because it's very clear how many visits are covered, what amount is covered. And so this can be a good option for, number one, people who have pre-existing conditions, people who, number two, have some other type of insurance, but it's not the best or doesn't cover the things that they want covered. So this might be somebody that is military. It might be somebody who's a W-2 employee and your company pays for health insurance. So you don't need the major coverage. If you have an ER visit or a surgery or something, you're going to be taken care of, but your day-to-day appointments and chiropractic, acupuncture, prescriptions, those kinds of things aren't covered or aren't covered very well. Or people who are 65 and older who have Medicare, this can act as a supplemental to Medicare, and I have a couple of those. So that's actually really good coverage for some people who want that. What's covered by ClearShare? Almost everything. So there's no network like we talked about. You choose any provider. So on the medical side, so accidents, emergency room visits, hospital stays. Again, the telemedicine is available 24 hours a day, 365 days a year. The mental health sessions are available. Care coordination. This is a really important piece because, as it being a health care, like I mentioned, you're paying for something, you're getting a receipt for things on the holistic side and submitting those. But if you have something major like a surgery, or you were in the hospital and you need help, this care coordination is a department to help with that. So you can open a claim and have them help you and support you, act on your behalf if there are any discounts available, that type of thing. I like to share this one example of a gentleman who had needed I think it's a hip replacement surgery, and he had the $5,000 annual max. I hope my sound is okay because I keep hearing weird feedback, so I hope you guys can hear me okay. If you would let me know in the comments, I'd appreciate it. Um, but anyway, the care coordination department gets involved. So with this gentleman, he picked his doctor. He was going to have the surgery done at a hospital, and okay, good. Thank you, Reese, for confirming that. So he was going to have it done at a hospital. He was quoted $80,000 being the price. He involved the care coordination team. They did some research and they found out the same doctor could do his surgery at a surgery center, and the price for it was going to be $40,000. So half the price. Obviously, he elected to do that to save money. And for that, involving the care coordination team and going with their direction that saved the organization as a whole, all of us, obviously, that $40,000, he didn't have to pay his $5,000 annual max for that procedure. So it was waived. His fee became $0. So that's huge because you think about it. With our premiums, he saved us 40,000. So huge, huge benefit to having that team that's working on our behalf. Then to continue through the list, pregnancy and postpartum, whether you're giving birth at a hospital, a birthing center, at home health care, pain management injections, hormone therapy, medical supplies, nutritional services, occupational therapy, speech, massage, all kinds of things. So the massage therapy in this category, when it's separate from a chiropractor, is a maximum covered at $3,000 per year when you have a medical need. That requires a doctor to write a prescription, but not if you're doing it as an add-on at a chiropractor. So there's a couple of ways massage can be covered. I like to point that out. And then you can see the list, it kind of goes on here. There's lots of things. But on the top of this, I like to share the international medical treatment. So if you're traveling internationally and you have an emergency room situation, you need to go to the hospital, something major happens, you have an emergency, you can get medical treatment and again, have it covered through the medical plan, and you don't necessarily have to purchase travel insurance. So that can be huge for someone who's traveling a lot. So I really like that one. This shows on the holistic portion what the coverages are. So as I mentioned, the monthly reimbursement for Young Living essential oils and supplements for individuals, it's $50. For families, it's $75. Primary care visits, again, anything on here, you pay for it, you get a receipt, you submit it, and you get reimbursed. You need to submit your receipt within 30 days. So that's also important to know. But on the primary care, look at the list of doctors. You can go to a naturopath, you can go to a medical doctor, osteopathic doctor, really anything. I actually just found out that you could go to a dermatologist as those visits, and those are covered. So it's up to $150 per visit. We're responsible for the first 20. So again, you pay for it and you get reimbursed, except for that $20. Breast imaging, huge benefit. Another thing that I really, really like is that you can choose mammography or thermography. You go once a year. And when I had traditional insurance, I would go and do thermography, but I had to pay for it out of pocket because I didn't want the radiation exposure that you get during a mammogram. So I'm super excited to have this as an option now to have that better imaging and coverage for it. So I'm not paying for it out of pocket. The chiropractic and acupuncture, I talked about that already a little bit. It's up to 24 visits per year. And then IV drips. On the prescriptions, their generic is covered at 100%, and preferred brands, it's kind of, on case by case because obviously there's thousands of medications in the world, so it would depend on it and that. But we have a customer service support team where you can get information on that. If you're like, oh, hey, I have this medication that I know that I need refilled every month or every 90 days, you can find out what that cost would be like. For people who don't want the full holistic plan and they want a more cost effective monthly premium option, there is a holistic savings option. So, this one for the chiropractic and acupuncture it goes from 24 visits to 12 visits. It does not include the mammogram option and it does not include the prescriptions. And on the doctor visits, the other one was 5 visits per year. This one goes down to 3. So, kind of depends on what your needs are, but it gives you option to have a couple of different things and not have the full plan if you're not going to use it. The Clear Share plan, so this is pricing. Let me take a drink real quick. I feel like I have a scratch in my throat and I don't want to be coughing here. So when you're looking at this, so this is if you want medical coverage only, not any of the holistic doctor's visits. So this is like your major medical stuff. So first thing you do is you look at what age category does the oldest person that's going to be getting coverage fall under, and you can cover anybody within your household. If it's just you that needs coverage because your spouse has good coverage through a job, then you are only looking for single. So single, married, you can do cohabitating. So if you live together and you're not married, if you're single with kids or your family with kids, then your category with your age. And then you're going to look at which annual max are you comfortable with. So let's say if you are 42 years old and you're single and you're comfortable with a $5,000 annual max, your monthly premium would be $230. So I'll give you a minute. You can take a screenshot here. You're welcome to do that. I'm happy to send you the replay after we have that available if you'd like. And that, but like for example, my family, we do the combined plan. So I think it's the next screen. I'll show you that. And we do the 2,500 annual max. And it's not $2,500 for each of us. It caps out. So I'll explain that on a later screen as well. But just giving you a second there to make sure you had a chance to take a screenshot. This is if you want holistic only. The next screen is combined. So holistic only. Um, if you want the single, again, same categories of who you're covering and what the monthly price would be for that. So this one is the holistic savings, the more basic holistic plan with the medical coverage. Just a brief moment. Same information of how you're doing that, but I want to pause so you can take a screenshot if that's what you're wanting. And I can also send you these images directly so that you have them easier if it's not easy for you to take a screenshot, depending on what device you're on. So this is the plan my family has. So my husband's 47. We did the 2,500. So we fall in this category. We are a family with kids. And we did the 2,500. So we are at $920, and then we add on vision, which is another screen to that. So that's what gets us to, I think, what's it, 955 is ours that I showed on that earlier screen, and that. So super easy for figuring out what the price would be uh, for whatever plan it is that you're looking for. This, I'm just kind of pausing and talking so you can have an opportunity to take a screenshot here as well if you want or need. Okay, so family annual max. Again, like I mentioned earlier, it's not whichever category you choose, 1,000, 2,500, or 5,000. It's not per person. So my family of four, if it was per person, that would be $10,000 a year. But it caps out at that rate of 3. So for us at the 2,500 being a family, we cap out at 7,500. So if myself, Garrett, and my daughter Grace each had something and spent 2,500, and then something came up with Keegan, he wouldn't have any out of pocket because we have met the max between the three of us. That makes sense. So it's 2,500 per individual and then 7,500 total on that. And then this is just kind of explaining the details of that for the annual max, emergency room visit, hospitals, ambulance, surgeries, physical therapy, that type of thing. If you want vision and dental, this is the add-on option of it. It is not typically as discounted as the other plans. So if you're comparing something, this was for us more comparable price-wise. The dental coverage, we didn't end up shifting ours. We kept the old policy that we had because it was like within $5. And I think my daughter is going to probably need, possibly, I'm hoping not, but she might need braces. She's only 4, so we've got time. Um, but the orthodontic coverage is less than it was for on our other plan. And then again, the monthly premium was within like $5. So I stayed with the other just to keep and have that. And the vision was good, very comparable. So that's why I switched vision to this as well. And then if you're needing both, there's the bottom is the pricing of having both policies. Feel free to take a screenshot if you need it. And so how does this work? So this is a relationship between my company, Young Living, and Clearwater. So first thing you do is when you're ready to enroll and get set up is that you make sure you have a Young Living account. You can get an account by buying something, or we can set you up simply with a free account. We just have to make sure you have a username and password that then links to Clearwater. So Clearwater administers the plans. So there's sign up through that. Then they do education. They take your monthly payment for your premium. They administer the like reimbursements. You have access to a portal, and they even do the reimbursement for the Young Living essential oils and supplements when you have the holistic plan. So it's a partnership through both. You do need to have a Young Living account in order to qualify for the pricing through Clearwater. When you're ready to sign up, here's kind of an idea of timing. So if you sign up today or anytime between now and April 30th, your coverage you would choose your start date, but it begins on the first of the month. So you would choose May 1st, June 1st. You can choose a later date but that's when your coverage is active. And then on the 10th of the month, after your coverage is active, it's the 9th or the 10th, whatever ends up being a business day, is when you pay for your premium. So your coverage is active before you pay your premium, and then you begin submitting receipts. Super simple. Again, you have access to the team if you have something major going on, an accident or an emergency room visit, so that you can get that support, and that's active from the beginning. Any questions? I kept it to 26 minutes tonight.